8.8 million of people internally displaced from one area to another area because of the area of the farming. There is another group of really very good group of people, a chunk of, we totally forgot about them because the Syrian regime is very clever, taking a lot of activists from the street, detain them, torture them to death. When we heard about 11,000 people has been tortured to death in one detention center, when we know in Syria there is at least 100 of those detention centers. So just imagine how many people behind the bars and how many people has been lost or vanished inside the Syrian community, and nobody knows really the total number, but the coalition expected that this number is reaching about 250,000. So if you look at this atrocity, it's absolutely horrendous. At least the children are really the major part of paying this price. There is at least 1 million child refugee outside the country, in addition to maybe it's about 4 million people, 4 million child inside the country are really in great need of help. This is a slide produced by WHO. This is on the Royal Society of Medicine, presented by the WHO itself on December 2013, where they're talking about 64% of the public hospital inside Syria has been damaged. And this is about 5 months ago. Now we can say clearly there's at least 75% of the hospital inside the country damaged by the fighting. And we are going to tell you how is that damaged and who's actually responsible for that damage. And the health worker have been either killed or has been injured or kidnapped by the Syrian regime as a systematic torture and practice of war crime inside the country. Now, I would like actually to highlight this paper that's written by the UN itself. This has been published in September 13 by the UN. It's a long report, but that report, I actually just took a snapshot of that report. They're talking about the assault on medical care in Syria is systematic, and it goes on and on and on to the scale of become unbearably really bad. And they're talking about there is a deliberate targeting of hospitals, medical personnel, and transport, and with the denial of access to medical care and ill treatment to the sick and wounded has been systematically going on in the Syrian land by the government, unfortunately. And the government forces has been systematically denying medical care to those from the opposition control area as a matter of policy. So when we heard about this from the UN, so what is the action? This is our question really. How we can improve the humanitarian condition when the UN already published this about almost like now 8 or 9 months ago, and there's still no action to stop the aggression, to stop the brutality.